Hi, my name is Amber Berleen. I'm a nurse practitioner here at Ironwood Cancer and Research, working in the Glendale and Avondale offices. Thank you for joining us for our Lunch and Learn series. We're going to talk today about colorectal cancer screening. For today's information, I'm using guidelines from the American Cancer Society. You'll find other guidelines out there, and those have great information as well. So what exactly is colorectal cancer? Colorectal cancer is when there are cells that abnormally divide either in the colon or the rectum, and they start to grow uncontrollably and eventually cause a tumor. I'm sure you've heard about colorectal cancer, either a family, friend, maybe you heard about it on the news with a celebrity. There's obviously also Colorectal Cancer Month that you probably get more information about. And the reason that you hear about it so often is because it's one of the leading causes for men and women in the United States, and unfortunately the second leading cause of cancer-related deaths in the United States. The American Cancer Society updated its recommendations around 2018 for colorectal cancer screening. It states that adults of average risk, age 45 years and older, should undergo regular screening with either high sensitivity stool-based testing or visual examination like a colonoscopy. It also recommends that results from non-colonoscopy testing that come back positive would then be recommended for a colonoscopy. I'm sure many of you are thinking that maybe colorectal cancer screening starts at age 50 if you're average risk, and you're not wrong. The reason these guidelines were adjusted is while the incidence of colorectal cancer has steadily declined over the past few decades, the incidence of colorectal cancer in those that are under the age of 50 has also been climbing. It's important to know what makes you an average risk for these guidelines. Someone that's average risk does not have a personal history of colorectal cancer or certain types of polyps on previous testing. A family history of colorectal cancer or hereditary syndrome also will put you at a higher risk. A personal history of an inflammatory bowel disease, such as Crohn's or ulcerative colitis, or a personal history of getting radiation to those areas of the abdomen or pelvis for another cancer. There are a few different ways of testing and colorectal cancer screening. One test that you may have heard of or seen a commercial on TV is stool-based testing, and a lot of people choose to do that because it is less invasive than a colonoscopy. It's something that you'll want to talk with your primary care or your gastroenterologist about as to how often or when that would get started. This testing is good, but also there are other types of testing that, depending on your personal history, may be more recommended by your provider. Some of the testing that is more invasive, there's something called a virtual colonoscopy. There's also something called flexible sigmoidoscopy, and then colonoscopy, which is probably what most people have heard of. These are a little bit more invasive than just the stool testing, but also all are very important. You're looking for the same thing, which is early detection and early screening to help prevent something more serious down the road. The time between testing for all of the modalities will just be dependent on your results. For stool testing, it can be as early as every 1 to 3 years, and for colonoscopy, it could be as early as 6 months or 10 years, just depending on what they find. The goal of that colonoscopy, again, is early detection, but also to remove tiny little polyps that can eventually turn into a tumor. Despite your current health, you should still talk to your doctor about when screening is appropriate. A lot of times people don't have symptoms until cancer is advanced. So regardless of if you are not having any symptoms or not, talk to your doctor to decide when it's good to start either the stool testing or be referred over for a colonoscopy. I'd like to end this discussion with some important lifestyle changes that you can implement yourself to lower your risk of colorectal cancer. Maintaining a healthy weight can help to reduce your risk of colorectal cancer. Increased physical activity can also help lower your risk. And there are some dietary changes that can help lower your risk. Diets that are high in fresh fruits, vegetables, whole grains, lower in red meats, meats, and processed foods will all help lower your risk of colorectal cancer. Avoiding alcohol and smoking will also help lower your risk. It's never too late to start or consider colorectal cancer screening. So even if you're over the age of 75, it's still important to talk with your doctor to see what's going to be best to make sure if you are at risk, to catch things early and go ahead with colorectal cancer screening. Thank you so much for joining us today for our Lunch and Learn on colorectal cancer screening. Please go to our YouTube video to continue to get up to date and see what's going to be next on our Lunch and Learn series. The link will be just below here.